Hi, I'm Caitlin Astor. I'm here to talk to you about cephalosporins. These are very widely used antibiotics in the United States. They are structurally similar to penicillins. And just as penicillins do, these interfere with bacterial cell wall by either promoting lysis of the cell wall or interfering with the synthesis of it, causing the bacteria to burst. Different cephalosporins absorb differently. Only 10 can be given PO, rest can be given IV or IM, but they have a good distribution. Most of them have therapeutic concentrations in the peritoneal, pericardial, or pleural fluids. Third to fifth generations can be given for meningitis. They have a reliable concentration in CSF. They do have poor concentrations in the ocular fluid though. Cephalosporins generally have a half-life of 30 to 120 minutes, with the exception of ceftriaxone, which has a half-life of 8 hours. So this is an increased dosing interval, of course. Most of the cephalosporins are excreted by the kidneys, either by tubular secretion or glomerular filtration. The exception is ceftriaxone, which is metabolized by the liver and 30% excreted through bile. There are 5 generations of cephalosporins on the market in the US. As bacteria are becoming more resistant to older generations, newer ones are developed. The first generation cephalosporins will be on this side. They are cefadroxil, cephalexin, and cefazolin primarily. There is also cephadrine listed by this website, but not by the textbook. First generation cephalosporins are usually used for surgical prophylaxis because of the high resistance for bacteria. Second generation cephalosporins are cefuroxime, cefoxitin, cefaclor, cefprozil, and cefotatin. These are used for sinusitis, otitis, respiratory tract infections in general. Third generation cephalosporins are cefdinir, cefditoran, cefixime, cefotaxime, ceftazidime, ceftibutin, and ceftriaxone. These can be successfully used for neonates and infants. They can be used against meningitis, Haemophilus influenzae, E. coli, and Klebsiella. Fourth generation cephalosporins are cefepime and ceftalozane. These can be used against highly resistant bacteria, complicated intra-abdominal infections, complicated UTIs. They can be used against Pseudomonas in the hospital. They are very good. The fifth generation cephalosporin is ceftaroline, and this can be used for highly resistant hospital-acquired MRSA infections successfully, as well as for other highly resistant bacterial infections. Some things to remember with cephalosporins: they are excreted by the kidneys, therefore reduced dosage may be needed with decreased kidney function. Use cautiously with patients with renal impairment. Also keep in mind they can cause drug interactions with probenecid, which decreases tubular secretions of these antibiotics and can increase concentration, and can also cefazolin and cefotaxime can interfere with vitamin K metabolism and promote bleeding, so give these cautiously with anticoagulants. Couple more things are to be cautious when prescribing it with impaired renal function, as mentioned before. Advise patients to look out for allergic reactions such as dyspnea, urticaria, hives. And cephalosporins are generally safe throughout the lifespan, but be cautious when giving it to breastfeeding mothers, as it can interfere with the infant's GI tract. These are the resources I have utilized to make this video, and thank you for watching.